Welcome to 10 with Dr. T, featuring Dr. Matthew Terzella. Brought to you by Piedmont Physical Medicine and Rehabilitation.
Hi, I'm Dr. Matthew Terzella from Piedmont Physical Medicine and Rehabilitation in Greenville, South Carolina, and welcome to another edition of 10 with Dr. T. Today I'll be talking about a topic that is very familiar, unfortunately, to a fairly large subsegment of the population, peripheral neuropathy. Now, for those of you who have been following along, I did discuss this briefly in my foot pain podcast. However, I thought this was such an important topic, I felt it best to drill down a little bit more deeply into peripheral neuropathy. Peripheral neuropathy affects a great number of people, and it can affect our day-to-day lives in a very profound way. Many of my patients who have it often complain of it being one of the biggest stumbling blocks to their overall health. They're often at odds in terms of finding ways to treat it and what they can do about it as they go about their lives. Well, first I'd like to start with, what is peripheral neuropathy? What is it doing? What does it affect? Well, on a large scale, it tends to affect our feet and legs first, and then our hands and arms. That's generally what is known as peripheral neuropathy. At the smaller scale, it affects the very small blood vessels that contribute to all those little tiny nerve endings in our feet and our arms. And guess where we have a ton of little nerve endings? Our feet and our hands. So that's why those are two areas that are most affected. In fact, a lot of people start to get it, what they call the stocking glove distribution, basically from area from below the knee down to the feet, and then once it reaches a certain stage, they'll start to feel it right in their hands. So it's not a pleasant experience all the way around. Now, those of you who have peripheral neuropathy already know what I'm about to say in terms of symptoms, and those of you who don't may know someone who does. But people complain of a variety of symptoms: numbness, tingling, pain, sometimes described as a fire-like pain, which is very difficult to get rid of. Many folks with peripheral neuropathy will complain that their feet are worse when they're at rest or even at night when they're trying to sleep. Some will also develop some restless leg syndrome symptoms as well because of the irritation. It is not a very pleasant situation for any of these patients. Some will also have some cramping in their calves and feet. I have had several patients who come in and say, "No, I don't have neuropathy." I'll examine them and there are signs of it. And then I finally ask them, "Well, do you have any pain?" "Well, no." I said, "Well, do your calves and feet cramp up?" "Oh, yes, all the time." So that is another lesser known symptom of peripheral neuropathy that folks should be aware of. Now, the biggest question I get is, "Well, doc, what causes this? Why am I having this?" Well, there are a multitude of reasons. One of the biggest causes is diabetes, and diabetic peripheral neuropathy is very common. With the number of folks in our country who have diabetes, it makes complete sense. Diabetes affects the tiny, tiny little blood vessels, which again affects all those tiny little nerves in the feet and then ultimately the hands. Unfortunately, diabetes can also affect the kidneys, liver, and all the other organ systems in the body. So it's really all around a bad disease to get. But for the purpose of this talk, diabetes does cause peripheral neuropathy in a lot of cases. Also, folks who have high blood pressure, high cholesterol, basically anything that affects the blood vessels, that can predispose them to a peripheral neuropathy as well. I often see that in conjunction with smoking. Smokers do tend to have a higher rate of peripheral neuropathy because that does ultimately affect the blood vessels. Anything that affects the blood vessels will affect the smaller nerves as well. Another subset of the population who gets neuropathy are patients who have cancer. Many of them have had radiation, chemotherapy, with chemotherapy being a large risk factor for developing a peripheral neuropathy. These can be debilitating as well. So, as you can see, there are many, many reasons why someone could develop a peripheral neuropathy. And the most frustrating one is the one of the patient who has none of these conditions. They just have neuropathy just because they have neuropathy. And I get asked that all the time. "Well, why do I have this?" And my answer is, I'm not quite sure. But we do know they have it based on their exam and our ways of diagnosing it. Which leads us to the second set of this talk. How do we diagnose it? Well, it's both a clinical and a testable type of diagnosis. The clinical aspect of it is we test for the sensation in the limbs with a little bit of pinprick sensation, also a vibratory sense. If those are diminished, it gives us an idea that these are clinical signs of having peripheral neuropathy. What the patient is feeling are these symptoms: the numbness, the tingling, the cramping, and the pain that we've already talked about. So you have the signs and the symptoms that contribute to this. Now, from a diagnostic standpoint, one of the things we routinely use is electrodiagnostics, particularly a nerve conduction study. With this, we take what looks like a little bit of a cattle prod, quite honestly, and we send a little electrical shock through the nerves, and we look to see if they're slow or if they're not conducting appropriately. When this happens on a broad enough scale, we can delineate what type of neuropathy they have, whether it's sensory or motor, affecting the nerves that move the muscles, or demyelinating, meaning is it slowed, or axonal, meaning is the peak higher or lower. That's how we can tell and characterize it. Those with diabetes often have a sensory and motor with both an axonal and a demyelinating component. So it's all across the board. That's one of its hallmarks. So the electrodiagnostics are really important in determining if someone does have a neuropathy or peripheral neuropathy. The signs give us clues, the symptoms give us clues clinically, and then we do the electrodiagnostics. However, there's also a case where the electrodiagnostics do not pick up any large fiber nerve problems. That's what we're measuring on an electrodiagnostics, large fibers. So some folks will have what they call a small fiber neuropathy. They'll have the clinical signs and symptoms, but a completely normal electrodiagnostic study. Now, these folks often will end up going to see a neurologist. They'll get a biopsy where they'll take a little punch of the muscle with some of the nerves and look for nerve density to see if they meet the criteria. So that is a really interesting one, but ultimately it can be treated in the ways we'll talk about next. So great. Here you go. Your feet and legs are burning, trouble walking, can't feel the steering wheel. You have all these things. You go to the doctor, say, oh, you have peripheral neuropathy. They confirm it on testing. So great. What do you do? Well, the basics are good nutrition, eating enough fruits and vegetables, vitamins and minerals, hydration. And I like to have my patients use compression socks to help the blood flow back and forth through the veins. Those are mainstays. I also encourage them to get massage and using lotions to help keep the skin supple, because you don't want to any openings in the skin, because that could predispose to some infection. And you may not be able to feel that an infection is brewing. And if that happens, it could spread rather quickly, and that could lead to a pretty serious situation. So massage helps, lotions help, all of these things help stimulate blood flow. Now, outside of these things that you could do at home, there are also treatments available that could potentially help you. One, there are the medications, things that I'm sure all of you are familiar with, like gabapentin, Lyrica, what else is there? Things like duloxetine. All of these types of medications help stabilize the nerve endings to help the symptoms feel a bit better. Unfortunately, these all don't work for some of the patients, and some when they do, there are some side effects to them that may make them difficult to handle and difficult to continue with this particular medication. There are also treatments available that involve laser. Now, there are several health providers who provide laser. There are chiropractors. My practice also provides laser treatments as well, and that's thought to by using laser to affect the little tiny blood vessels around the nerves helps to reduce the signs and symptoms, as well as reverse them to a certain degree. One of them, called the Relief product, is actually through the University of Minnesota Medical School, where there's software that was devised there based on a large study, and it has proven to be very effective. That is what we use in my practice, and it does help a lot of individuals. So there are options out there if you look around. So even though it's very difficult to live with, there are ways to make your life a lot better, despite having the ailment. But truly, one of the best ways is to correct the underlying problems, getting your blood sugar under control, your cholesterol under control, your blood pressure under control, and maintaining good nutrition. Those things will help a great deal in hopefully managing your symptoms. Well, that's really all I have to say about peripheral neuropathy. I hope this didn't get too crazy with it, but it's a fairly common problem. And I just wanted to introduce some ideas for you to think about and to consider moving forward, whether you have it or if someone else that you know has it or one of your family members. There are ways to combat and treat it, and there are also ways to look for it. So remember, things that you could do, again, if you have it: massage, compression socks, good nutrition, good hydration. Those are the building blocks and basic ways to start. Beyond that, go see your doctor, see if there are any medications they could potentially give you to help with some of the symptoms, and be on the lookout for some new and innovative treatments such as laser, because these can really impact your life in a positive fashion. Well, I just want to thank you for joining me today. If you have any more questions or any thoughts of pursuing this a little bit further, please feel free to visit my website at www.piedmontpmr.com. That's www.piedmontpmr.com. And thank you very much for your time, and I hope to see you again on 10 with Dr. T. Have a good evening. Thanks.
Thanks for listening to 10 with Dr. T. To learn more about resolving your physical pain, visit piedmontpmr.com.